And guess what? It's Breast Cancer Awareness Time here on WHIG. We always think it's important to do this every October. We have with us this morning Kathryn Beamon from Boice-Willis Clinic. So glad to have you here.
Thank you so much for having me as well.
Good morning.
Good morning.
Yes, and Kathryn is the Imaging Department Manager.
Mm-hmm. Yes, ma'am.
So this morning we hope you're watching. Ladies, listen up. Men as well, because you're supporters as well. So anyway, we just want to find out what we can do, prevention, awareness, all kinds of things. So we'll just dive into it,
Sure,
Kathryn, this
great.
morning. And we want to thank Boice-Willis Clinic for always being such a wonderful partner. They just feel like it's so important to get this information out as well. So anyway, so what is breast cancer screening? What is it?
Yes, so breast cancer screening, it's comprised of your monthly self-exams and your yearly mammograms.
Okay.
So if your breasts are imaged yearly, we can detect small changes within that breast tissue to determine if there's an area of concern more quickly if we can do that on a regular basis.
And that's why it's so important.
Yes, ma'am.
Because you can, early detection is what they say is so important.
Yes, ma'am, it very much is. And we're just as much a part of that. So doing those monthly self-breast checks and then having those regular mammograms and making sure that we're staying on top of it helps us get early detection.
And I know some of the young people ask, when should they first start? When should you first start getting mammograms?
Yeah, so we typically start doing yearly mammograms at 40 years old. That's when most insurance companies and the FDA has kind of set forth that standard of 40. But if you do have a strong family history, you can speak with your doctor and they may be able to start your screenings earlier.
Right. That makes sense. Okay, because history is kind of important, isn't it?
Yes, and it would
breast
be more
cancer
on your maternal side.
Okay.
Yeah, that breast cancer history more on your maternal side.
Okay. Okay.
Yeah.
All right. This is a good question. Are they painful?
So mammograms can be uncomfortable because it is required for us to compress the breast in order to get good views of all of that breast tissue throughout.
Right.
So it can be uncomfortable. However, I can speak for our technologists at least, and any breast mammographer that I have met, they do their very best to make sure that the patients are as comfortable as they can possibly be, while also getting the images that are needed.
And that's important because you want to, while it may be a little uncomfortable, it's important that they get what they need.
Correct.
Right?
Correct. Yes, ma'am. Because if they don't get that full compression, there may be an area that they don't see with that mammogram. So we have to get it to a certain level to make sure that we're getting all of the information that we need to get a complete view of the breast.
Absolutely. Okay. What are the indicators of the early signs of breast cancer?
So there's typically no physical signs. Some people will experience a physical lump when they're doing their monthly self-checks, but that's why the mammograms are so important, because those lumps can be so tiny, and depending on how dense your breasts are or how large they are, you may not be able to physically feel that lump or that area.
You may not detect it.
Yeah, so and then there's some things that are higher concern for breast cancer, and that would be skin changes, kind of dimpling in the skin. Some people call it orange peel skin.
Okay.
Any kind of like a nipple retraction, any discharge coming from the breast that would be abnormal based on your age and your life cycle, and things like that. And then changes in the size of the breast as well. So if one is much larger than the other, those types of things would be of high concern on a physical standpoint. But most breast cancers cannot be detected physically. They must be detected through diagnostic imaging like mammograms.
Okay, very good. What is the difference between a mammogram and the screening? You know, we hear about mammograms and then we hear about screenings. So what is the difference?
Yeah, so with the screening mammogram, that is kind of your annual mammogram that you come in for. We have a subset of images that we have to acquire for that. And then some people are called back for what we call additional views.
Okay.
And that's where an area of concern may have shown up on your screening mammogram.
Okay.
And so they want you to come in for what we call a diagnostic mammogram.
Okay.
For additional views where they hone in and kind of focus on that single area to
Right.
see if it truly is something of concern or if it was just an abnormality seen on the screening.
Sure.
There's other types of screening as well. There is screening with MRI. Which
Okay.
is quite a costly adventure.
Right.
You know, most insurances will cover the screening mammogram at full cost for their patients. MRI is a different subset, but that can be used as a screening tool as well. However, the
Okay.
gold standard is screening mammograms.
Okay. Okay, that makes sense. How important is knowing family history? You addressed that a little bit earlier. How important is that?
Yes, so a strong family history can increase your overall lifetime risk of developing breast cancer. So always let your technologist know if you've had any changes to your family history. You know, each year we kind of poll our patients as they come in to say, hey, has anyone in your family had any breast cancer?
Right.
And we ask that question yearly because last year your mother may not have had breast cancer, and then
Right.
this year she was diagnosed. So it's very important for us to stay up to date
Yes.
on that. And then with that strong maternal gene, if your aunts, mothers, grandmothers, sisters, especially if it's like a twin sister situation,
Right.
things like that, it's just very important for us to know.
So it goes back, that's what I was going to ask you. So how far can it go back? I mean, an aunt, a great aunt, you know, any.
Yeah, we usually try to focus on that immediate family
Okay.
circle. So that would be like mother, direct aunt, like maternal aunt,
Yes.
grandmother, and sisters. That's typically like the highest risk
Gotcha.
population. But anyone that's been affected, even if it's on your paternal side, it's still important to notify your technologist.
Absolutely. And it is so important that they don't leave anything out. It is important that every year they update your history and get, as you said, you've already said that, but I will say it again, that is so important
Yes.
for the technologist to know your history. So what questions will you be asked when you go for your mammogram or your screening?
Yep, so they'll ask about your personal history, your family history of breast cancer. They'll also ask if you've had any surgeries to your breast or around your breast for any other reason. Some
Okay.
people will maybe get like an abscess or
Yeah.
have mastitis when they're breastfeeding. Those types of things may
Right.
lead to scar tissue, things that we need to be aware of that may show up on the mammogram as
Right.
an abnormality. They'll also ask like your basic female history, your menstrual cycles. Have you been through menopause? Have you not? You know, how often are you having your cycles and when your last one was? Because our breast tissue changes when we are going through our cycles.
Yes.
And so things can show up there. And then your technologist will also ask if you've had any changes since the previous year.
Right.
If you've noticed any changes within your breasts in the last year.
Well, you know, when we go for our mammograms and screenings and things like that, it's always a nervous time for the patient. Awaiting, what am I going to hear? What am I going to hear? And it's always the biggest relief when you get a card in the mail and it says, everything is cool. So, you know, that's always good. So how long do we have to wait? How long does it take to get the results?
Yeah, so each facility varies somewhat. I can speak for our facility and kind
Okay.
of what our guidelines are. If we have all of your priors, so if you've had breast imaging at another location, we need those images so that we can do a true comparison of your current mammogram to see if there's been any changes. So that's why it's also important for you to try to be routine in where you have your mammograms, and to make sure that, you know, if you're not jumping from facility to facility. We welcome anyone to join us at Boice-Willis for their mammograms. We can get your priors and then we can start tracking you, you know, within our facility. But if we have all of those priors and we're able to do that comparison, a typical time frame for report turnaround time is within 2 days. Sometimes
Okay.
it's same day. Sometimes it's within that 2-day window, but even with the priors, it would be no more than 30 days.
Right.
So if we're unable to obtain your priors, we will go ahead and result that current mammogram as is, and base it off of kind of like a new baseline.
Right.
If we're not able to get those priors. So if you're moving from out of town and we're not able to get those within 30 days, we're going to go ahead and get those results for you and start moving forward with your care.
Yes. Well, I'm sure Boice-Willis, you know, there's always state-of-the-art equipment that comes out, and, you know, the latest, greatest thing that we hope. So, does Boice-Willis have the greatest, latest equipment?
Yes, ma'am. So we have a hologic system, which is kind of the bee's knees of the breast imaging world. It's the equipment that everybody wants.
Right.
Ours has the ability to do what we call 3D mammograms.
Yes.
Yes.
Sure.
So that is, of course, the gold standard now, is to perform 3D mammograms on all of our patients.
Right.
So we do have that equipment. It works very well. It's very nice looking. And our technologists do a great job of making sure that that equipment is doing what it needs to do to help the patients. And then for our ultrasounds, if someone needs a breast ultrasound following up, we do have new Philips ultrasound machines and trained technologists to assist in your breast ultrasound if a follow-up is needed with that.
Okay. Well, wonderful. That's good to know. Well, Kathryn, tell us if somebody today decides that I really need to do this. I have not had one in a couple of years. And how often, if you don't have any problems, you have not had any problems, how often do you recommend?
Annually.
Annually,
yes,
okay.
Yes, there is some conflicting information. Some facilities say every 2 years, but for us to maintain that congruency, it's a whole lot easier to keep up with. You know, if you say, okay, on my birthday month, every year I have to have my mammogram, we're much more consistent if we do this annually.
Right.
And insurance companies will cover it as an annual screening as well.
Okay, so that sounds good.
Yes, and if you have not had your mammogram, please reach out to your primary care provider, your OBGYN, anyone that can, you know, send in that referral. And if you want to send it to us at Boice-Willis, we'll be happy to take care of you from there.
So if somebody has a primary care doctor somewhere else, can they have a screening or mammogram at Boice-Willis?
Yes, ma'am, they sure can.
Okay.
Yes, so we serve all of the community, not just Boice-Willis patients. So in our imaging facility, we can perform those exams on all patients, you know, of course, if we're in network with their insurance and all of those details. But yes, we get outside referrals frequently.
That is wonderful to know. And if there's anybody out there, as I said earlier, that's thinking, oh, I hadn't had one in 2 or 3 years, I really need to do it, you can certainly call Boice-Willis Clinic, and they will be glad to help you with your mammogram, your screening, whatever it may be. So, Kathryn, thank you.
Yes, thank
this
you
has
so
been
much.
Very informational. So join us tonight for UNC Nash is going to have a oncologist on, so we're trying to run the gamut and really show, you know, everybody, get all the information out there that we possibly can to help everybody get screened, and early detection is just so important. As we say, detect it, treat it, defeat it. So we appreciate Boice-Willis sponsoring our breast cancer awareness, and it's always good to talk to the imaging department because they're the actual ones. No matter how many doctors we have and providers, they are the ones that really do the job.
Yes, ma'am. Yes.
And so we really appreciate y'all.
Yes, well, thank you so much, and we enjoy doing it. I will say that, you know, from the breast imaging standpoint and from any of our imaging team members, we really enjoy taking care of our community and doing what we can to help.
Thank you so much, Kathryn.
Thank you.
All right, we'll be right back with you right after this.